Really good to have you with us, Doctor. Can we begin with this situation in Gaza? Because I know you've been to the enclave several times in your capacity as a doctor. We know this war on Gaza has now passed the 1-year mark. What is your understanding in terms of the situation on the medical crisis that's happening there right now? Just how bad is it for hospitals there?
Well, this is, to my knowledge, the worst medical man-made disaster in human history. I cannot recall any other situation where a state and a state army has been doing so systematically attacks on the healthcare system and on the healthcare providers. The recent UN report that came last Friday is summing up that the Israeli occupation forces have perpetrated more than 1,000 attacks on healthcare in Gaza and the West Bank during the last year alone, and killed more than 800 healthcare workers. So this is a systematic modus of operation, and the report also states that they, quote, they have plans and procedures to attack healthcare, unquote. So that alone is a disgrace for the US and Israel, of course, because all of these institutions and personnel are protected by international law. So that's beyond any doubt the worst attack ever on healthcare and healthcare personnel. But I think the most devastating and inhuman part of the Israeli politics is the systematic starvation and thirsting of 2.2 million people, of whom half are children. This is beyond doubt a systematic genocide. And I'm sick and tired of listening to the US trying to put some makeup on their brutal policies of supporting Israel with endless amounts of arms and bombs. This is an obscene masquerade, and I think it is an insult to any intelligent person on earth what they are now claiming in the UN Security Council, that they are protesting against Israel's lack of supply of humanitarian resources. It's right that it's only 50 trucks entering Gaza per day now. The normal amount before this attack started in November last year was 500 trucks, so it's 1/10. This is by all means a systematic and brutal and also very sadistic way of eliminating the Palestinian people and to fulfill their colonial ambitions of taking over Gaza. They use the medical system as a way to strangulate the people of Gaza, and the scenes have been horrible for a year, and I cannot understand why the European states are not standing up and demanding from the United States to stop the weapons supply to Israel. It's good news that Ireland and Spain now will demand that EU is canceling the trade agreements with Israel. The only language Israel is understanding, it is sanctions, and it is economical crisis, and it is stop in weapon supplies.
Yes, the report that you referred to there was conducted by a committee of the UN Human Rights Council over almost a year since the war began, arguing that Israel is targeting Gaza's medical infrastructure. But Israel has also been accused, as what you alluded to, using starvation as a weapon of war. We've heard many anecdotes of that being the case, but do you believe that that is in fact happening in Gaza right now? And is the US key here in order to not only stop these attacks on medical facilities in Gaza, but to stop starvation being used as a weapon of war?
Absolutely. And starvation is a weapon of mass destruction, and weapons of mass destructions are illegal according to international law. So there is absolutely no doubt that Israeli officials use both disease, epidemic diseases, and starvation as a tool, a means to obtain their goal, which is the colonization and the annexation of Palestine. I mean, it can be absolutely no doubt that this problem could have been solved within 24 hours had the gates to Gaza been opened and had the international flow of humanitarian supplies under international control, mind you, not under Israeli control, been allowed, as usual is in disasters, this problem would not, this disaster would not have occurred. So this is a planned strangulation. And we have to understand also that among 2.2 million people, there are people with heart disease, with diabetes, with psychiatric disorders, and not at least with infections who are lethal, who needs a healthcare system. It's not only those who are affected by the bombs and the shooting of civilians. All of these people, they go under the radar. We don't know the numbers of how many of them are dying from avoidable causes. The last report from the UN was that now it's 42,000 killed. This is probably a gross underestimate. I would imagine 25% underestimate. I think we're reaching 55,000 killed and 100,000 wounded. This alone is a taxing of a health system which no health system in the world could amend, let alone a system that is being strangulated and do not get supplies. So it's on the one side, it is the lack of food and water. On the other side, it's the lack of supplies to the hospitals. This is systematic genocide signed off by the United States of America and by Israel, with the silent support by the governments of EU. It is one of the greatest human disgraces. It is a complete moral collapse in the West, and it will stain our history for generations to come.
Okay, Dr. Mads Gilbert, we will have to leave it there. But thank you so much for sharing your thoughts with us here on TRT World.